Cosmetic dentistry. Now, there's a subject. Basically, there are several problems that seem to crop up in my daily practice here at Fresh Dental Care. And they are that patients are fundamentally unhappy with the appearance of their teeth. And it seems to me that it falls into three categories. Firstly, they are unhappy with the colour of their teeth. And that can be corrected by using tooth whitening, and we can talk about that in a moment or two. The second thing is that they're unhappy with the shape of their teeth, and that can be corrected by veneers, which we'll talk about in a minute. And also they might be unhappy about the positioning of their teeth, which can be corrected by veneers and also orthodontics, and we'll talk about that in a moment. So let's talk about tooth whitening first. Basically what happens is we take a mould of your mouth, we send it off to the lab, we make a little tray, you put some hydrogen peroxide gels in the tray, that sits onto your teeth at night, and the hydrogen peroxide bleaches the yellows and brown colours out of your teeth. So that's tooth whitening. Highly effective and very comfortable and simple introduction to cosmetic dentistry. An awful lot of my patients do that and then go on to other things, or sometimes that's enough for them. Okay, in regard to the actual shape of the tooth, then we may need to do a veneer. A veneer is where we cut away a little bit of the tooth. Okay, it sounds pretty horrible, but we make sure it's completely and utterly numb. It doesn't hurt at all. And then we take a mould of the tooth, that goes off to the laboratory, have a temporary veneer. What comes back from the laboratory is a beautifully crafted piece of porcelain, which is glued onto the front of the tooth, and that makes the tooth look exactly the right shape for your smile. And that's just a fantastic thing to see. So that's sort of veneers, but it might be that your teeth are significantly out of line, in other words they're crooked, in which case you might benefit from some orthodontics. Now orthodontics comes in two types. Basically we can take some moulds of your mouth again and we can have some aligners made. Aligners are clear plastic trays that fit very comfortably on the teeth, and they're computer CAD/CAM produced to gradually move your teeth into the right position. So you can have orthodontics now as an adult without having to have a wire. But you can also have a wire, and to make it acceptable to my patients, the little blocks that fit onto the teeth and the wire are tooth coloured. And as a result, a lot of patients find that acceptable. So what's the difference there? Well, the clear aligners can take a little bit longer to straighten the teeth, and it's a little bit more expensive, and it doesn't do quite as good a job, in my opinion, as having some blocks and wires. But it's always your choice. So we could do some tooth whitening, we could do some veneers, we can do some orthodontics, either with wires or without wires. And as a result of that, what you would get is the smile that you've always dreamed of. And hopefully that would make you feel confident, and you'd smile, and the confidence would radiate out as a result of your smile. And that would be a glorious thing. So if you're interested in any cosmetic treatment, then don't hesitate to come and see us at Fresh Dental Care and have a consultation, and we can go through this in some depth and detail. Thank you.